Namaskar, hello and welcome to Sansad TV. I'm Tina Jha, you're watching Perspective. 27th of December 2021 marks the second International Day of Epidemic Preparedness. It was on this day in 2020 that the United Nations General Assembly advocated the importance of the prevention of, preparation for and partnership against epidemics, calling on member states to observe the day through education and increasing awareness on epidemics at the local, national, regional and global levels as effective measures to prevent and respond to future epidemics. To commemorate the day this year, UN Secretary-General Antonio Guterres said, "The coronavirus pandemic shows how infectious diseases can sweep across the world, push health systems to the brink and devastate lives and families." He said the havoc caused by COVID-19 reflects that the world learned no lessons from outbreaks like Ebola, Zika, SARS and several others, also cautioning that the coronavirus pandemic will not be the last one that humanity will face. The UN chief called for immediate coordinated action by the world to prepare for future health emergencies. So today on the show, we will talk about the significance of the International Day of Epidemic Preparedness, particularly at a time when uncertainty has once again grown worldwide over rising cases of Omicron. What the world needs to do to come out of the shackles of COVID pandemic and also prepare for future pandemics. To discuss all of these aspects, I'm joined on the program today by a distinguished set of panel. So let me first introduce them to you. I'm being joined by three distinguished panelists virtually. Professor Narendra Kumar Arora, he is Chairman, COVID-19 Working Group of NITAGI. Mr. Sanjay Kumar, he is former Director General of the National Disaster Response Force. And Dr. Sanjay Kumar Rai, he is National President of the Indian Public Health Association. Thank you, gentlemen, for joining me on the program today on Sansad TV. Professor Arora, allow me to begin the program today with you. So as the world marks the second International Day of Epidemic Preparedness, there is growing uncertainty once again worldwide due to rising cases of Omicron. So if we talk about India, how prepared are we to deal with the current crisis at hand?
I would say probably it was divine design or prophetic that a year ago, this day for epidemic preparedness was kind of initiated, launched. And today we see how important epidemic preparedness is there.
Yes.
And not only at global or country level, this is so relevant even at district and sub-district level. And this just clearly goes on to show that even slight complacency and slackness can create a volcano of infectious disease. So coming to your question about Omicron and countries' preparation, I think India has taken the COVID pandemic not as a tragedy, but as a great opportunity to strengthen ourselves, to really put all our wisdom and science into epidemic preparedness. And over last 1 year, I must say that we have now got a real vibrant as well as state-of-art epidemiology platform, I would say. We have data systems which are IT-based. We have molecular epidemiology, and we have surveillance for genetics of infectious disease and virology. And this has informed our health system preparedness, our service system preparedness. So I would say that although the pandemic brought a lot of discomfort, we have lost a lot of precious lives,
Yes.
but simultaneously we have not let this epidemiology opportunity go in vain. And now we are better prepared than ever for Omicron and the future epidemics coming in months, years, and decades ahead of us.
Okay, look at 2 years back and the outbreaks that we have seen in the form of COVID pandemic. There were systemic challenges that globally every country faced. There were public health systems collapsed in even the developed countries. We faced our share of challenges as well in India. Now, as we stare at a potential third wave and also amid warnings by the WHO that there will be future pandemics as well and we need to be prepared all the time, what is the state of our public health systems now in dealing with outbreaks like these?
See, during last 1 year, we have expanded. First of all, I'll come to the health system, the intensive care system, oxygen supply system, the availability of drugs, buffers on one side. Now, the projections of the experience of last 1 year has helped us to project our requirements and project our requirements for much larger load, and therefore we are prepared for that.
Okay.
The second thing which has come up is that the best of entrepreneurship has come in, so that we can use public health interventions. Vaccine is the best example. Two of the vaccines which are we are using are both made in India. And just imagine if these vaccines were not prepared in India, what would be the situation? We today we are one of the fastest kind of rollout country for the vaccines, and almost 90% of the adults have received at least one dose, and 60% adults have received two doses. So these are public health preparedness we are talking about. And then coming to the dimension, another dimension which we should never forget, and which is part of public health preparation and health system preparedness, is community engagement. I think the kind of community engagement India and the Indians have shown is I would say, unique. And we have seen that, despite we know that we have to reiterate, but the way we have tried to follow corona appropriate behaviors, we have scaled down our social interactions remarkably. Our marriages, social, religious functions have really they have thinned out so much in last 1.5 years, that we now know that this has been another very important public health tool which has helped us to tide over and to come over to what situation we are today.
Okay. Dr. Rai, let me bring in you into the discussion and understand what is your perspective on how do you look back at the kind of challenges that we have faced as far as our public health system is concerned, of the two severe waves that we witnessed in our country, and how are we bracing ourselves for future such outbreaks to prevent what we saw in the earlier two waves that is not repeated? How prepared are we in terms of our public health systems?
This virus is not a new virus. In last 2 years, we have generated a lot of evidence against this SARS coronavirus 2 and COVID-19. If you see the lot of publications, so we have sufficient evidence. We don't know everything about this virus, but we know something, at least many things about this virus, and all predictions should be based on the available evidences. So for our country, even for the globe, if you see the report of 2019, this global epidemic index, epidemic preparedness index, India was not in the first 50. Almost all European countries and your US, they were in the top 10. A few European countries and US, they were in the top 10. And majority of European countries, they were in the top 50. India was not in the top 50. But even though they were best prepared for pandemic, and that index was based on some checklist pandemic, what happened, we all know. So the management of either this SARS coronavirus 2 infection or management of disease in both, India is doing very well. Now coming to India for preparedness for our third wave. We know the second wave was really devastating, very devastating. A lot of people died, and the infection was very high. So that time during April and May, that was a very unfortunate for this country, for many people, almost for many families. So we lost our near and dear during that time. But today, if you see, that is our strength. Whatever evidence globally we have, now we know that those who recovered from COVID, they are the best protected person on this earth as of now. There are a lot of publications. That's why I said now it's the time to use the evidences.
Absolutely.
And then the second is your vaccinated people. Those who are susceptible, that never had COVID, are not vaccinated, they are at the greater risk. But the best protected, if you see the best protected, those who recover from the COVID, then vaccinated. So in India, we have a hybrid type of immunity. We had very a high infection rate during the second wave, that is April, May, almost 4 lakh. We detected 4 lakh cases per day, but actual number could be several times more than that. When this ICMR did sero survey in June, July this year, 2021, they found almost 68% positivity. If you see the Delhi report, almost zero positivity. Even in the children, it's around 90%. That means majority of our population, they were exposed to this SARS coronavirus 2. And this is the, for 2 days, this is the strength.
Okay, okay.
So even suppose if this Omicron is a very highly infectious virus, within 15-20 days, almost spread to more than 80 countries. But in our country, we are at really in good position, so based on both.
Okay, so in addition to the physical infrastructure that we have strengthened over the past few months, this is one additional strength that Dr. Rai is pointing out. Mr. Kumar, let me bring in your perspective on preparedness for future pandemics. And in this regard, the role of the NDRF becomes very, very crucial, because the NDRF is just the third in line after the doctors and the health workers when it comes to dealing with such kind of emergencies. Now, given the changing nature, scale and severity of pandemics that we are witnessing, and amid warnings that there could be future infections that the world may be looking at, what role is the NDRF playing in upgrading its training for the personnel in dealing with future such emergencies that we might see?
Yes, as exemplified by the ongoing COVID-19 pandemic, major infection diseases and epidemics have devastating impacts on human lives, wreaking havoc on long-term social and economic development. Like any disaster, preparation is the most important phase. Better preparation means less vulnerability to the disaster. And this is the formula we are applying in this case as well. Disaster management Act, as we all have seen, came into force as soon as the lockdowns were announced last year, and it was decided to enforce it in toto. States took preventive steps, the steps to manage the people over there, and in that sense, we all implemented through the IPC, the other Epidemic Diseases Act, etc.
Okay.
Now, at the institutional level, policy planning is one aspect that includes the NDRF, also preparation of NDRF as well. Then involvement of community is the key for NDRF. We prepare the community because in any kind of disaster, it's the community which is the first responder, and the same applies here as well. Be it the children, be it the local people, be it the panchayat people.
Certainly, a multi-pronged approach is required, and that's what the purpose of International Day of Epidemic Preparedness also says, that a multi-pronged approach, all stakeholders need to be aware of how to prepare themselves, how to brace themselves for situations like these. Professor Arora, in times like these, experience is said to be the best teacher. So looking back, because India has, in a way, led the world in eradicating diseases like polio, like smallpox, and our success rate has been quite high. How has that battle, or how have the strategies adopted back then helped us in our current fight against COVID, and are also helping us prepare strategies for the future pandemics?
Thank you, Tina. You stole words from my mouth. Actually, I've been very closely associated with polio eradication program, and epidemic preparedness is one of the finest. In fact, for since 2011, we are polio free. Although we know India is such a huge country and viruses could enter anytime, but this epidemic preparedness is the one which really kept us all through these 10 years, 11 years on our toes. The second thing is that there are examples, both dummy examples, as Mr. Sanjay Kumar was saying, that you have to be prepared, and better prepared you are, less vulnerable. So this preparedness drill is done in an annual basis or a biannual basis across the country in all states for polio, measles, and rubella also outbreaks. And that has also helped. I am aware that somewhere in 2016, when we were shifting from trivalent oral polio to bivalent, and there was some mutation, or which is vaccine-derived polio virus outbreak occurred small in Hyderabad, the response team reacted and responded within 48 hours and stopped the outbreak within that 48 hours. The initiation took place in 48 hours. And I think these experiences have helped us to learn from whatever we had learned during last 20, 30 years during polio eradication. Smallpox also was there. And now what we have done is that everyday learning is being built, is being used to guide our action for the next day. So whatever we had the difficulty during the first wave, then the second wave, this has held us in a manner that the country is today confident that whatever may be the outcome or possible outcomes of Omicron, the country is fully geared to that. Be it manpower training, manpower preparedness, infrastructure in terms of beds, oxygens, drugs, and then a very meticulous surveillance system. And today we are well into a genomic surveillance, which is as good as one of the best in the world.
Okay.
So this is a constant learning process, and we have prepared ourselves to see that any eventuality which is coming in weeks and months, we should be ready to do it.
Absolutely. So the lessons learned from the past are helping us.
But the infrastructure and the learning, I would certainly say that polio and measles epidemic preparedness exercises have done tremendously good for the whole health system to make it resilient, as well as fidelity has come in.
Certainly. So the lessons from the past, Dr. Rai, have helped us create or have an effective response to the current crisis, and also prepare a roadmap for the future pandemic as well. When we talk about an effective response to any kind of disease or an outbreak, early detection is the key. And even when we talk about preparation for future pandemics, future potential waves of COVID-19, early detection and rapid response will remain the key in the times to come as well. How are we faring when it comes to rapid epidemiological response in terms of early detection and surveillance?
See, since the beginning of this pandemic, this early detection was one of the major activity. Not only major activity, if you see the most resource intense activity of this country, and in many of the other countries also, WHO recommended this, and we started with this. This contact tracing is one part of them, the contact tracing. So we started with the contact tracing, and really it's a most resource intense activity. If you see the entire health administration and your district administration, they are involved. If you ask any district magistrate or any CMO of any district that what was your most resource intense activity, that was the contact tracing. And for any infectious disease, communicable disease, one of the most effective strategy. But somehow now we have sufficient evidence that this is not playing a very important role here. I'm giving you an example. The objective of this contact tracing was to identify all the potential cases early so that we can prevent the further spread. Yes. This was the sole objective of this contact tracing. So how will you know that spread is happening or not? There is only one mechanism, and that is your sero survey. Take example of any sero survey. First sero survey done by ICMR, or last sero survey done by ICMR, or any state level survey. I'm giving you an example of the first sero survey done by ICMR in May last year. And that your point was 30th April. It takes 15 days to develop antibodies, at least 15 days. So on 50th April, there were around 35,000 cases, less than 36,000 cases in this country. The sero survey indicated that the seropositivity was total 0.73%, and this is correct figure. They said 99% people is susceptible. Yeah, 99% people, they are susceptible, right? But if you convert this into number, 0.73 into number percentage of people, 1 crore 10 lakh, 137 crore population, with you multiply, and we detected 35,000. During early phase, contact testing was very easy, per day 100 to 200 cases. So even that time, we are unable to detect the total potential cases, almost more than 99% of the cases. Okay. And why this is happening? Because this disease, even COVID majority, is asymptomatic. Asymptomatic are also transmitting disease. Pre-symptomatics, they are transmitting it. So somehow it's not working in this. So that's why I said, now it's time to use the evidences. We have sufficient evidence. Do you know, we are spending more than 200 crore rupees per day on this only kit, testing kits. Forget about other paraphernalia like your PPE kit, etc. RT-PCR kit and rapid kit. Okay. This country is spending, but we have never analyzed. So now it's time to analyze all this. There is no need to spend this type of money on if that particular activity is not working. Okay. We also recommended. Initially, I also said several times that this is the only way to control this problem. But now when we generate evidences, we must stop this. There are various ways we can discuss other ways, but this is not the right way. Okay. Professor Arun, I'll come back to you to understand. One of the concerns that the World Health Organization raised during the pandemic was that because of COVID-19, other immunization programs and response to other diseases like tuberculosis, like HIV is being impacted. So if I could understand from you, did the COVID-19 lockdowns or the pandemic period impact our universal immunization program as well in India?
Yeah, so thank you. And this is a very important component. So in April, May last year, when there was universal lockdown and other disruptions occurred, health system disruption occurred. In fact, there were 20 to 30% decline in our routine immunization coverage. But special efforts were required and were made so that at least we should reach up to pre-pandemic level. Although we have not still reached there because our coverage had increased beyond 90%, we are around 85. So 5-7% still is lagging behind. So you are right that the routine immunization in children was affected. Okay. The second thing is that routine healthcare was also effective initially, but I think, and more so during the second wave, there was a lot of disruption. But over this time, I think the health system as well as the public health system, the clinical services and the public health system have learned how to cope up so that the usual care, whether it is cancer patients, kidney patients, liver patients, other chronic disease and other acute infections, they are also met. But
absolutely, and it's very
absolutely
important.
Correct. There is disruption, and it requires innovative conditions, and several of the states have done those innovations so that the disruption is to the minimum.
Certainly, it's important to minimize disruptions and continue with our effective response to other epidemics as well, along with the current crisis that we are dealing under of the COVID-19 pandemic. All right, so with that, I'll have to call it a wrap on this edition of Perspective. Thank you to all my guests for joining me on the program today and sharing your thoughts with us and our viewers. It was indeed a pleasure having you on the program. So that's it from us on the program today. Thanks very much to all our viewers for their time.